Hi, and welcome to another ICS Impulse video. I'm Wendy Crumley Welsh, the product manager for ICS Impulse, and today we're talking about the new Vision Denied solution. The Vision Denied solution is only for the Impulse goggles. So this is really cool. It's light tight, very innovative, disposable, and comfortable. So over here, the Vision Denied solution is two pieces. First, you have the right eye cup. Remember, the ICS Impulse records from the right eye. So what's amazing about this right eye cup is it allows for the camera to see through this black window and record the eye movement, but the patient cannot see through the black window. So it is light tight. And then this piece over here is for the left eye. So that's the left eye patch. So that covers the left eye. And this will allow you to do testing with vision denied, which you may want to do for gaze, you may want to do for spontaneous nystagmus, and also for positional testing. One thing to know is do not touch the black window of the right eye cup. That's because any fingerprints that got on there can affect the anti-fog on the inside. You also don't want your fingerprints on there because it'll affect the camera's ability to track the pupil. So you don't want any fingerprints touching or any fingers touching that black window when you place it onto the patient or take it out of the bag, etc. The other thing to note is that you want to remove any mascara before using the vision denied cups. If mascara gets on the inside of the vision denied cups, it will impair the ability to track the pupil and video the eye. So first thing, let's talk about attaching the right cup. First, remove the plastic backing from the adhesive on the cup. Ask the patient to open their eye wide, and it's easiest to position the cup if you and the patient are sitting at the same level instead of you standing over the patient. So you want to be sitting at the same level and make sure have them stare straight at you. You're looking at the pupil, and you're going to get that pupil centered into that black window when you place that cup over their right eye. Ask the patient to stare straight ahead, and you want the pupil again to be centered in that black window. If the patient's eyelid droops, hold the eyelid up when placing the vision denied cup. This will assist you in keeping the patient's eye wide open during testing as well. So you will see a ridge on the inside of the cup. This ridge, which you see right here, should sit up against the patient's nose. So that's the part that goes towards the patient's nose. So you want to make sure that you get it up against the patient's nose and then still get the pupil centered into the black window. You want to bend the adhesive edge and place the ridge up against the right side of the nose. You want to make sure the cup is centered over the eye. You don't want it angled up or down. And again, when you're doing this, do not touch the black window of the right eye cup. Again, fingerprints can make the anti-fog on the inside not work and make it difficult to track the pupil. Or just the fingerprints will make it difficult to track, period. And you want to press gently around the edge of the vision denied cup to make sure that a seal has formed all the way around. And you want to make sure the cup is light tight. So you're going to put on the right one. After that, you're going to attach the left vision denied patch. They can close their left eye if they want. You're going to remove the plastic backing from the adhesive of the patch. Ask the patient to close their eyes. Make sure the patch is covered over the eye, not angled up or down, with the wider side of the patch towards the nose. And then press gently around the edge of the vision denied patch to make sure a seal is formed all the way around. Again, you want to make sure that patch is light tight. Now, verifying light tightness. You want to give the patient a couple of minutes for the eyes to adjust to the dark, and then ask the patient if they can see any visible light. Do not have the patient look directly at a light bulb, at a spotlight, a halogen, or incandescent light bulb. If you have them looking directly at a light bulb, there will be a little light leakage. If you just have a normally lit room, or even a room that has window light, that's fine. But you don't want them looking straight at a spotlight when you're testing. And then once the vision denied cups are attached to the patient and no visible light is present, you want to proceed with attaching the goggles and testing. So placing the ICS Impulse goggles. You want to position the goggles on the patient with the cup centered inside the goggle. And you want to tighten the straps so the goggles stay on the patient during testing. but the goggles do not have to be as tight as needed for head impulse testing. So if you're using the vision denied solution for the monocular video frenzel, for gaze testing, spontaneous testing, positional testing, it needs to be secure enough so obviously the goggles stay on, but you do not have to make them as tight as we do for head impulse, because we're not really worried about goggle slippage when we're using the vision denied solution. The other thing is, if you tighten them real tight, you're kind of pushing the cups into the person's face, and it makes it not comfortable. So again, just tighten them enough so the goggles stay on, and that's good. So here is a picture showing good position and poor position. So the good position here, you can see the pupils in the middle, you can see the whole entire eye. Over here is a poor position. You can see that this side is too close to this edge of the eye. There's more skin below than above the vision denied cup. So we've got this thing shifted too far to the right and too far down. So you want to make sure that you have a good position when you're using the vision denied solution. It's more comfortable for the patient, and you will get better pupil tracking. In order to do fixation suppression with the ICS Impulse goggle, you're going to want to use a pen light and shine it directly at the vision denied cup. Do not shine the light through the mirror. The light will not transmit through the mirror and through the cup. But you shine the light directly at the cup, and then the patient will see a red dot inside the cup that they can fixate on. When you're removing the cups, it's important that you want to make sure that it's comfortable for the patient. So you want to ask the patient to close their eyes, and then surprisingly slowly pull the cup off. This isn't like a band-aid. We don't want to rip it off. But if you slowly pull the cup off or the patch off of the patient's face, so slow removal is more comfortable than a quick removal. And lastly, using the vision denied solution, here is an example of an eye recording and an eye position trace.